When we explore a visual scene, our eyes jump from one point of interest to the next, making what we call saccadic eye movements. These eye movements allow us to explore areas of interest, and in doing so, activate visual neurons in the successive visual stages of the hierarchy of information processing. It is important to remember, however, that every eye movement directs the highest resolution part of a retina, called the fovea, to a very small area of the image. This is the only place of the image in which we can see in high detail. And it's a tiny visual space area equivalent to the width of your thumbnail at arm's length. And so when we look at any kind of visual scene and it appears to us in high resolution throughout, this is an illusion. In reality, it looks more like this at any given point in time. Only the part that we're looking directly at, we can see in high detail, and everything else is low resolution. Let's look in real time at the eye movements that we produce when we explore a scene like that. Saccadic eye movements, or eye jumps, take our eye to areas of high interest, such as faces, also presents, and you can see that the eye is really pretty much in constant movement. If we look, however, at the points of relative fixation in between saccades, we see that there is more that goes on, and the eye is in fact still in motion when it appears to be still. So here we have a picture of children holding various kinds of props. These are the scan paths that show the trajectory of the eye motions throughout the image. And if we zoom in, you can see different kinds of eye movements. Here we have microsaccades. These are microscopic saccadic eye movements that we have in red. And you can see that these microsaccades tend to occur not in every fixation. Fixations are denoted by purple circles here. Not every fixations contain microsaccades, but the fixations that occur in areas of high interest, such as faces, those tend to generate a lot of microsaccades, as if the visual and oculomotor system working together are producing microsaccades to gather information from information-rich regions of the scene. And the same occurs when we explore a visual scene trying to look for something, in particular, in this case, Waldo. These are the eye movements that an experimental participant is producing, trying to look for Waldo. Waldo is inside of the blue square, and you can see that these saccades in black, and microsaccades are also occurring, but most microsaccades concentrate when we find Waldo or we find another target of interest. We're using microsaccades to check, recheck, confirm, and verify that Waldo, our target of interest, is there. And we're going to see that the same occurs now in a minute when the subjects come back and they're still verifying that Waldo is there and he hasn't gone anywhere. It's still where we found them. And again, you can see that there's a lot more microsaccades in red being produced in that area of interest. So these are some of the features that describe the eye movements that most people, healthy people, produce when they explore a visual scene. But eye movements can also tell us something very important about brain disorders, because the oculomotor system spans most of the brain, from the frontal lobes to the cerebellum to subcortical nuclei. It's virtually impossible. We haven't found the case in which there is a neurological condition or an altered physiological state that doesn't lead to a change in the characteristics of eye movements. This is from a study that we conducted in collaboration with John Lee's laboratory at Case Western Reserve University. This is we started this line of research about 10 years ago in my laboratory. Here we have a subject that is affected with PSP, progressive supranuclear palsy. The subject is trying to stare right ahead, but is producing these involuntary horizontal eye movements that we call saccadic intrusions. They have the characteristics of saccadic eye movements for the most part, but they are intruding or interrupting accurate fixation. And studying the characteristics of such eye movements can be very important for the early and differential diagnosis of various neurological conditions. Here we have the top 3 eye traces correspond to patients of PSP. The lower 3 eye traces correspond to normal subjects. And so you can see that this kind of saccadic intrusion, we call it square wave jerk for its obvious square wave shape, is not exclusive to neurological patients. They also occur in healthy participants, but in this case you can see with perhaps lower frequency and definitely with lower magnitude. So it is important to understand what's pathological versus physiological in eye movements. And we found, for instance, that both in PSP patients and in healthy subjects, the coupling mechanism that returns the eye to fixation after the first saccade is produced, that is comparable in both healthy subjects and in PSP patients and patients of other movement disorders. So here we have, for instance, 2 fairly large saccades in an eye trace. They're over half a degree of visual angle, and because the error signal is small, there is almost immediately a return saccade that gets generated to produce the error, to counteract the error. But if the first saccade doesn't generate a strong enough error signal, then there is no return saccade. So we have been using these kinds of measures to try to understand the neural basis of neurological disorders in various kinds of conditions and how to differentiate among them. But this is not all that eye movements can tell us. Eye movements also inform how we acquire new skills or develop expertise. And this is the subject of a recent collaboration that we started with the radiology department here at Downstate, that is led by Steve Waite, and in collaboration with my lab and the lab of Steve Magnick as well. We have been looking both at attendings and at residents as they develop the expertise to find lung nodules in medical images. And these are just a few examples of participants that have low, intermediate, and high accuracy as they search these images, and we present them with images of various kinds of difficulties, from very obvious to extremely subtle, and then we analyze the patterns of their eye movements. And just as we previously found with Waldo, we have new data. We're wrapping up the results for publication that indicates that when participants, radiologists and radiologists in training in this case, when they identify an area of high interest, in this case containing a nodule, you can see that they have an abundance of microscopic saccadic eye movements being produced to gather this information from the image. I'm out of time, so I'm going to leave it here. I would just like to thank my lab members, especially Robert Alexander and Ashwin Venkatakrishnan, as well as our collaborators and the funding agencies, the Empire Innovator Program, NSF, and NIH. And thank you all for listening.
So, thank you, Susana Martinez-Conde.